This is the specimen of skull. So today we are going to talk about the osteology of skull, more specifically cranium. If mandible is excluded from the specimen of skull, it is called cranium. The skull and cranium word is used interchangeably. The skull is divided into two parts. The upper part is called calvaria. This is calvaria. And the other parts of the skull is facial skeleton, which constitutes the rest of the skull and also includes mandible. The skull consists of 22 bones. If we exclude the bones of ear ossicles, that is malleus, incus and stapes, the calvaria or brain case, this is called calvaria or brain case, it is composed of 8 bones, 2 paired and 4 unpaired. 2 paired bones are parietal bone. This is parietal bone. 2 other paired bones are temporal bone. This is temporal bone. This is temporal bone. The unpaired bones of calvaria are frontal bone. This is frontal bone. On the posterior aspect, it is occipital bone. The sphenoid bone and ethmoid bone is present here. The facial skeleton is composed of 14 bones. This is maxilla, which is paired. The other pair bone of facial skeleton are zygomatic bone. This is zygomatic bone. This is zygomatic bone. 2 nasal bones are present. This is nasal bone. 2 lacrimal bone are present. This is lacrimal bone. 2 palatine bone is present. This is palatine bone. Inferior nasal concha is present in nasal cavity. The unpaired bones are vomer. This is vomer. The other unpaired bones of facial skeleton is mandible, which is removed or excluded in this specimen. Now, how we determine the anatomical position of skull? The skull can be placed in proper orientation by considering any of the 2 planes. The first plane or lines are reed baseline or reed lines. It is the horizontal line obtained by joining the infraorbital margin to the center of external acoustic meatus or auricular point. So reed baseline is a horizontal line obtained by joining infraorbital margin to center of external acoustic meatus. The other plane is Frankfurt horizontal plane. It is obtained by joining the infraorbital margin to the upper line or upper border of external acoustic meatus. Now, what are the methods of study of skull? The skull can be studied as a whole. The whole skull can be studied from the outside or externally in different views. We can study the skull from the superior view. This view is called Norma Verticalis. The other view is posterior view. This is posterior view, also called Norma Occipitalis. Other view is anterior view. This is called Norma Frontalis. The lateral view is called Norma Lateralis. And the inferior view, this is inferior view. This view is called Norma Basilaris. The whole skull can be studied from inside or internally by removing the calvaria. This is called calvaria. Now we can study the internal surface of cranial vault and internal surface of cranial base, which show anterior cranial fossa, middle cranial fossa and posterior cranial fossa. We can also study the skull by studying the individual bones of the skull. We are going to talk about Norma Verticalis. When we view the Norma Verticalis from the above, it is usually oval in shape. It is more wider posteriorly than anteriorly. Norma verticalis is more wider posteriorly than anteriorly. The shape is more nearly circular. So what are the bones which are seen in Norma verticalis? Upper part of the frontal bone, which is located anteriorly. Uppermost part of the, this is uppermost part of the occipital bone and parietal bone on each side. These bones of the skull are joined by immovable and fibrous joint. This is called sutures. The sutures present in the Norma verticalis are coronal suture. This is coronal suture. This suture is placed between the frontal bone and two parietal bone. The sutures crosses the cranial vault from side to side and runs downward and anteriorly. The other suture present in Norma verticalis are sagittal suture. It is placed in the median plane between the two parietal bone. This is sagittal suture. The other suture present in or seen in Norma verticalis is lambdoid suture. This is lambdoid suture. It is present posteriorly between the occipital bone and two parietal bone. It runs downward and forward across the cranial vault. In 3 to 8% of individuals, metopic sutures are present. It lies in the median plane and separates the two halves of frontal bone. Some other features of the Norma verticalis are the vertex of the Norma verticalis or skull. The vertex is the highest point on the sagittal suture. So the highest point in this skull is this. This is the highest point, which is called vertex. The vault of the skull is the arched roof for the dome of the skull. The bregma is the meeting point between the coronal suture and sagittal suture. So this is called bregma. In the fetus skull, this is a site of membranous gap called the anterior frontale, which closes at 18 months of age. On the posterior aspect, the lambda is the meeting point between the sagittal suture and lambdoid suture. So this is called lambda. This is the site of posterior fontanelle, which closes at 2 to 3 months of age. The parietal tuber or eminence is the area of maximum convexity of the parietal bone. This is the common site of fracture of skull. The parietal foramen. This is parietal foramen, which is located on either side of this sagittal suture. It is located 2 to 4 centimeter in front of lambda. This parietal foramen is located 2 to 4 centimeter in front of lambda. The parietal foramen transmits an emissary vein from the veins of skull into the superior sagittal sinus. The obelian is the point on the sagittal suture between two parietal foramen. So this is obelian. Now talking about the clinical importance of fontanelle. This is anterior fontanelle. This is posterior fontanelle. It is present in this area. Fontanelle helps in the growth of the brain. Anterior fontanelle is clinically important because intravenous fluids in the fetus injected from this fontanelle. When this fontanelle is tensed, it indicates the hydrocephalus, and when it is depressed, it indicates dehydration. Role of fontanelle and sutures at birth. If birth occurs by natural delivery, the baby head is larger in comparison to rigid and narrow birth canal. To adapt to that situation, the fontanelle and sutures allow a skull to compress and bone overlapping during delivery period. So this fontanelle also helps in easiness of passing of fetus through the birth canal.